This is Steve Carlson. I'm running against Al Franken for U.S. Senate on November 4th. I want to address the Democrats' suggestion to Thomas Frieden about Ebola coming to Minnesota. Very directly, Minnesota's Ebola response rollout is by definition far worse than its Obamacare rollout in Minnesota. Al Franken and Mark Dayton have bungled this one with potentially ELE consequences. That's extinction level event consequences for Minnesota. Let me stress, it should not be an ELE for Minnesota, but it has been for some areas. It has hit with fatalities up to 90% of the population. Just so we know what kind of a disease we're talking about. Senator Franken has been more interested in his re-election campaign than in protecting America from what will be the worst plague ever to hit our continent. It will be if the administration and the Congress do not rethink our strategy and act quickly to defend America and Minnesota and the Twin Cities from this plague. What Franken wrote is totally inadequate. Quote, as Minnesotans leave for and return from West Africa, we must do everything to protect them from contracting Ebola and bringing it back to Minnesota, unquote. First of all, they should not be going or coming back from West Africa. They should not be going unless they are part of a trained medical expedition with an expectation of fighting the spread of the disease in Africa and treating those who have it. They should be quarantined before they return. Dr. Fauci should concentrate his expertise on that procedure, not on maintaining the status quo. In other words, I do not suggest that we re-screen people who have already been screened coming into Kennedy Airport in New York, because of two reasons. First, it will draw resources away from that initial screening that has the purpose of protecting all Americans, not just Minnesota. Secondly, if someone is contagious on a flight into MSP, we have 150 infected people coming to the Twin Cities or Minnesota or traveling on all over the system. I strongly wish to develop an effective international strategy now, not the superstitious reliance on the presence of U.S. troops, but to understand and put an end to the threat of this disease. Neither the sending of 3,000 to 4,000 troops there, which I consider tantamount to treason by the Obama administration. They have no right to order troops to that flawed mission, nor this latest brainchild of Minnesota DFLers will in any way be an effective answer. One thing is clear. When two DFLers, Dayton and Franken, want to screen passengers at MSP in the middle of an election, you know this problem is touching us and we simply cannot ignore it. But Fauci's ideas, Anthony Fauci, that maybe a few will die in America, but not many, is wrong for America. And Minnesota leaders need to push for a different solution, one that is over there in Africa, not over here. Otherwise, we increase the risk that we cannot help those people. In response to the letter to Thomas Frieden today from Al Franken, Mark Dayton, and Amy Klobuchar, no, it will not be a satisfactory response to just give heightened screening to passengers arriving to MSP from West Africa and stopping somewhere else in the United States. There are no planes that just isolate West African passengers and bring them to the screening checkpoint. No, a West African passenger who should already have been screened, as Dr. Bong said, will be on the plane with about 150 other passengers. So if he's become contagious while on that plane, 150 passengers might be reporting into area hospitals days to weeks after arriving at MSP. Did everybody see the movie Outbreak? It's time to see it now. It's a 1995 medical disaster film. Stars Dustin Hoffman, Morgan Freeman, Rene Russo, Kevin Spacey, Donald Sutherland. Not to give away the plot, But at the end, there is no other way to deal with the American town except to detonate a bomb, apparently nuclear, over the town. Roger Ebert called it one of the great scare movies of our time. The notion that deep in the uncharted rainforest, deadly diseases are lurking, and if they ever escape their jungle homes and enter the human bloodstream, there will be a new plague, the likes of which we have never seen. Unquote. Right, imagine that. Apparently, this disease has indeed been lurking in Liberia, to be transmitted from animals to humans. Wikipedia reports that, quote, prevention, unquote, begins with, quote, this may be done by only handling potentially infected bushmeat while wearing proper protective clothing, by thoroughly cooking it before consumption, unquote. Excuse me, but I don't think this is an adequate defense against Ebola wiping out whole countries and states. Anyway, it wasn't followed. Let me say what policy I do propose as a nominee for the U.S. Senate running against Al Franken. All American actions, including visits by anyone from Minnesota purporting to help the situation in West Africa, should be directed at protecting the United States from this disease. That's all. That means that no, I would not support Dr. Anthony Fauci's idea that flights continue to come into the United States from this region. That is inherently foolish. I mean, it's a very bad idea. And as for expeditions to help the situation in Africa, that should only be done under strict adherence to a plan of action worked out by the world's best minds. Obviously, I do not believe Fauci's contentment with the status quo because of our supposedly superior medicine is one of the ideas of the world's best minds. In addition, I have already challenged the constitutional authority of Al Franken and Barack Obama to put our U.S. troops amid Ebola. This soldier in this film that I have already put up correctly predicts how these troops who are ordered by Obama to get involved in an Ebola-infected region at the request of the African presidents of these countries will result in cases of Ebola among our soldiers. They are not trained for Ebola. I strongly believe there must and should already have been a response to this, and not just CNN talking about over there. We must have known, and the bland assurances from the administration experts has been exactly the wrong medicine. They are obviously wrong. This is not to cause a panic, it is to cause an effective scientific response. The movie Outbreak, one of the very few movies I have seen at the theaters, is a scary movie, not because of the possible actions of the government. To me, that was never the plot of the movie. It was how these disasters run their course once they begin. Again, we need to identify this plague among the animal population and ensure it is not a food source for the African people. Science has given us knowledge to be free of Ebola, and we must have the political courage to achieve this. Here's why it's scary specifically, quoting from Wikipedia. To diagnose EVD, or Ebola viral disease, other diseases with similar symptoms such as malaria, cholera, and other viral hemorrhagic fevers are first excluded. Blood samples are tested for viral antibodies, viral RNA, or the virus itself to confirm the diagnosis. No specific treatment for the disease is yet available. Efforts to help those who are infected are supportive and include giving either an oral rehydration therapy, slightly sweet and salty water to drink, or intravenous fluids. The supportive care improves outcomes. The disease has a high risk of death, killing between 25%, that's the low, and 90% of those infected with the virus. The average is 50%. The average time between contracting the infection and the start of symptoms, incubation period, is 8 to 10 days, but it can vary between 2 and 21 days. So it's a confused mix. Typically, vomiting, diarrhea, and rash follow, along with decreased function of the liver and kidneys. Around this time, affected people may begin to bleed both within the body and externally. So this should be enough to give you an idea of just how dangerous this situation is. I would oppose the ideas of Franken and Dayton. I would say go to Washington and push for an effective fight against this Ebola outbreak, which is affecting the whole world, over there in Africa. Not with our troops, but with scientists and doctors and medical and health professionals who are trained with this, so that we can expect that there will be good outcomes, and secondly, that they will not be bringing Ebola back into the U.S. military and the United States. This is Steve Carlson, and I approve this message.